Suprabhatam. We have been speaking about Daivi Sampad and Asuri Sampad, and one of the Daivi Sampad is of Dana, to donate. And what can be a greater donation than giving life to somebody? Blood donation is something that all of us should involve in, and today, to educate us about blood donation, we have been associated with Narayana Blood Bank services for more than 10 years now. We periodically organize blood donation camps with them. Today, we have their representative, the in charge of the blood bank, Dr. Girish, with us. We welcome Dr. Girish. Dr. Girish is MD Pathology and he has worked as Associate Professor at Shimoga Medical College before he shifted to Narayana Blood Bank. Around 10 years he's been the blood bank in charge over there. Over to Dr. Girish to educate our staff and students about the importance of blood donation and how they can participate in the blood donation drive that we are going to have here. Thank you, sir.
Good morning, everyone. The Guruji and other dignitaries and the principals and the staff members and for all the students who are present here, my pranamas to you all. So it is nice to see so many people coming together for a simple cause every day for a prayer like this. So blood donation is an important thing which happens every day in our lives. So blood donation we are going to conduct in your premises on 23rd April 2024. So we have done this multiple times in your institute from nearly the past 10 years. So I thank for this opportunity given by the Guruji and the institutes for this. We have saved thousands of lives because of the blood donation camp which is organized here. So this year we want to conduct the blood donation camp based on the World Earth Day, which was celebrated on 22nd April 2024. The World Earth Day main theme this year is the plastics and the cancers which are there. So what we have? So we have planet or plastics. Plastics versus planet. So if we don't reduce the plastic usage as we go on, the earth will not be there to survive for us. So to prevent that, to make the earth live longer, or we all to live longer, we need to reduce the plastic usage. How the plastic is related to blood donation? These plastics which we use in our day-to-day life, where all we use plastics in the plastic bottles we use plastics to carry food items, we use plastic to carry multiple things because it is easier, it is cheap and it is easy to carry. After usage, we don't reuse it, we throw it in dustbin. So this dustbin, again, if it is not properly dismantled, they will be burned. Whenever these plastics are burned, they will cause cancerous carcinogens. These carcinogens are in air which we breathe together day in and day out. So because while we coming from, I live in Kengeri, from Kengeri to here when I coming, so we see multiple areas of plastic garbages there. They just are burnt like that. Whenever they burn it, definitely these plastics will cause carcinogens. Why are these carcinogens important? These carcinogens are going to cause cancers. Next slide please. These carcinogens will cause cancers. These cancers, one of the most common cancers we see in our hospital is leukemia. This leukemia is a blood cancer which is going to affect the small kids, newborns and the pediatric patients. These patients, if they are not treated with a bone marrow transplant or a proper treatment is given, they are going to die. So to save the lives of these small kids and all the people who are coming to our hospital in the Mazumdar Shah Cancer Research Hospital, where multiple different types of cancers are treated, and in the Narayana Rudayalaya Cardiac Center, where multiple different types of cardiac surgeries are done. These cardiac surgeries, initially we thought that only for the old age people. Now this is not so. Even young people are suffering from heart attacks because of the environmental changes and because of the carcinogens or the plastics which are inhaled through the lungs and they are blocking the vessels and they might cause the blockage of the vessel arteries also, and they can cause the cancers, they can cause stroke, they can cause heart attack. To prevent all these, what is required? The good doctors are required, the good diagnosis is required, and finally the surgery, if required, needs to be done. Surgery needs to be supported by blood. Blood is the one source which we can't produce in the factories. It has to be given by the human beings only. You and I will donate blood, only then it can be given to other person and we can save lives. How many lives we can save by donating once? How many lives we can save? 1, 2, 3, 4. Which is the correct answer? Any one of you can tell. So normally whenever we donate blood, we take this blood component into 3 different parts, and RBCs, packed cells, are plasma and the platelets, and we are going to save 3 lives. So we request you to come forward and donate blood without any hesitation, because those who are eligible only we are going to take the blood. How are we checking the eligibility criteria? We are going to check your hemoglobin levels. The hemoglobin level is more than 12.5, your body weight is more than 50 kgs, you are not suffering from any health issues, and you are not undergone any recent surgeries in the last 6 months, then a following questionnaires will be asked, and if you are fit enough to donate blood with all the criteria, only then your blood is going to be taken. So what are the advantages of blood donating? You will save lives, that is one thing. Second thing is, your bone marrow is stimulated to produce newer RBCs every day. So this, whenever suddenly 350 ml or 450 ml of blood is taken, your body will compensate that within 2 days. Within 48 hours, whatever the blood you have donated is going to come back to you. But for the next donation, you will be ready only after 3 or 4 months. So second is, there will be iron content which is more in some of the peoples, that is called as hemosiderosis. So whenever you donate blood, definitely that is going to reduce, the iron content is going to reduce, the cholesterol content is going to reduce, and if you are donating regularly once or twice in a year, definitely the risk of heart attack, risk of stroke is also going to reduce. These are studies which have been proven, because if we are not having any physical activity, whenever we go to blood bank, the weight will be checked. If the weight obesity is there, the corresponding advice will be given. If the BP is more, the corresponding advice will be given. If the hemoglobin is low, the corresponding advice will be given to how to improve the hemoglobin also. So after this all tests are done, the one more important thing what I want to stress is, so in blood banks we do the testing for different serological diseases like HIV, hepatitis B, hepatitis C, malaria, syphilis. All these tests are done. When they are found negative, only then the blood will be given to 3 different patients. If there is any abnormality, then the blood will not be given. It will be discarded in a proper manner. The donor will be notified, and the donor will be called to the blood bank, and we take a second sample from that, and then we do the required treatment or required necessary double testing, and then we'll advise what to be done. And one more important thing I want to stress here is, in our blood bank, we do ID-NAT testing. What is ID-NAT? Individual donor nucleic acid testing. This is the test which will detect as early as possible the different serological tests. So when it is detected early, there is no chance of blood being transmitted or infected blood being transmitted to others. So as safe blood possible can be transmitted to, can be given to the patient without any hazards because of that. So there are no major hazards for donating blood. So please come forward and donate blood, which is going to save lots of life. There is an acute shortage right now in blood bank because of the summer season and because of various reasons. The blood is reduced in the blood bank. So we request you again to come forward and donate blood and help us and help the earth by saving lives. Thanks a lot, sir.
Thank you, sir, for educating us on the blood and its importance, and also the myths which are associated with it. How very important it is to actually donate the blood to keep ourselves healthy. Thank you very much for educating all of us on this very important topic. and we are going to conduct, Narendra is going to conduct a blood donation camp on the Tuesday, coming Tuesday, and we request all of you to come forward and get your blood tested. First thing is get it tested. As he rightly pointed out, if the blood is not, if there's some contamination or if there's some infection, you will get to know yourself. So we encourage all the students to utilize this opportunity to donate the blood or to find out whether their blood is perfectly fine or not. Thank you once again for this beautiful lecture. We also have, as usual, so many visitors come to our Prashanti and get the benefit of Prashanti. Today we have Shri Krishna Rangarao from a great industrialist. Please do come here, sir. An industrialist, Rangarao Industries, and also a very active public servant, is the president of Rotary Club Mysore Zone. We are very happy that you are here, sir. We welcome you to Prashanti, and then we would request you to hoist the flag, and then you and then also the doctor together after our Shanti Mantra. Thank you. Thank you very much.
Sarve bhavantu sukhinah.